It is conference day 1. Bevan Erickson just did the introduction to the conference, and now Ray is doing her presentation on evaluation and management. She is phenomenal when it comes to E&M coding. So she's talking about some of the different changes that we had in 2021 with office outpatient visits. I am actually presenting for the virtual chat. I'm going to be the moderator for the first virtual chat session at 12:15, which is about networking in the virtual world. So I am just getting together, and I can kind of show you a little bit here. I've split my screen and I'm working here on the different bullets of things I want to cover and then watching the conference over here. I really have no idea how many people are actually going to come into the virtual chat, and I like to plan like I do my live streams. I like to have things prepared. I'm not just going to assume that everyone's going to come in and go, "Hi Victoria," and we're going to spark up a conversation. I'm hoping that my camera is going to work okay, because actually this camera is the one that I'm going to be using for chat. My other one is blurry, it focuses in and out, and then I have my document camera. I just replaced my computer recently. I upgraded from just a laptop to a real heavy duty PC that my boyfriend built for me, and it's having issues. And I'm not sure if it's Zoom yet or the computer. Sometimes it gets confused when I plug things in and out and in and out. It's not sure what to look for when you have 3 different cameras plugged into your computer. So over the weekend I was having my boot camp, and Zoom was really struggling and actually crashed at one point trying to process this camera, my Sony ZV-1. I'm debating if, since I'm not dressed inappropriately, but I'm wearing just my Reading chapter t-shirt, so I'm not sure if I want to switch over to one of my professional polos. You know what, I'll just switch over to my jacket. I have an AAPC logo jacket. I'll just throw that on when it's time to speak. I just finished up the general sessions, and then I hosted one of the virtual chats. So I moderated the chat. It was really good. There was about 50 plus people that were in the chat at the time. My main camera was giving me issues, so I did have my backup Nexago camera that I was using. I've been keeping notes. I don't know if you guys know this. I actually have these little notebooks that I sell on Amazon, and they are my medical coding notes, so this is perfect for my conference. I'm trying to do at least 3 key takeaways, like 3 things I want to learn from each of the sessions. I had to miss a little bit of this session because I had to run downstairs and make myself a salad real quick. Just lettuce, chicken, cucumber, tomato, cheese. It was so hard to pick what sessions I wanted to attend. A huge amount of people were attending. Out of the first breakout session, the evaluation and management. You do get recordings of the conference, so you can re-watch things at a later time. But I wanted to attend Healthcare Business Analytics and Why It Matters by my friend Rita, because I feel very out of touch sometimes with that business end, and it's just good to know what is going on so you can become more well-rounded in all of the different processes that are happening. You know, I don't do a lot of cardiology coding, so that's not really pertinent for me right now. DRGs I don't do. Internal audits for facility is probably not pertinent because that's more inpatient coding. I don't do inpatient coding. And then E&M, I'm like, I'll probably backtrack on that one and go through that one at a later time on their history and exam, like what is the medically relevant history and exam, which is an incredible topic, but I'm going to circle back, I think, on that one. All right, I just finished the data session. Okay, I'm trying to pick my next session, and they can be kind of tough. So our choices are strategic recruitment, planning, hiring, and onboarding, orthopedic surgery coding, infusion, hydration, and injections, developing, implementing, and delivering an audit program, or double dip. It's okay this time, capitalizing on the new E&M guidelines to maximize the assessment and plan. So I have 2 that I'm debating between. There's one on the E&M, the double dipping one, maximizing the assessment and plan. Oh, that's like really grabbing my attention, but I'm also not so great with infusion, hydration, and injection coding. So I kind of want to go through that. Hopefully maybe they'll have some sort of case studies, because that I think is an area where I'm weak and would like to be a little bit stronger. It is such a tough choice, but I think what I'm going to do is do non-E&M stuff and circle back on that E&M stuff with the recordings. So I think I'm going to go for infusions. I'm hearing a lot of background sound going on in the conference room right now. I'm not sure if the speaker realizes that we can hear everything that's going through on her mic in the earbuds. Oh, we're about to start. The nice thing about attending virtually is you always get a front row seat. Sometimes when you're attending in person, they have the room full and then they have to put you in an overflow room, so you don't get to see the person in front of you anyway. You have to watch everything on a screen. With virtuals, you never have to worry that you're not going to be able to see or hear anything unless you have connectivity issues, of course. It is day 2 Healthcon. It is 6:30 in the morning. I am not a morning person. I am very tired. I'm kicking myself a little bit for volunteering for the virtual chat because I did not realize that they were going to request me to be on at 7 in the morning. I actually wound up missing the last couple of minutes of the presentation that I was on because I got a call from the school guidance counselor for the second time in a week. It's been a pretty stressful school year already, getting my kid to adjust from virtual to back in person. So I wound up just having an anxiety attack and took some CBD oil because the prescriptions that my physician's trying to give me just put me straight to sleep. So till I got all of that squared away, made dinner, took care of my kid, got my videos edited. That was pretty much my day, and now I'm running on only a few hours of sleep. And yeah. I've got my coffee brewing right now, so let's recap a little bit on day 1. You know, I always love to hear Bevan Erickson talk about the AAPC updates. I was surprised he did go over a lot of industry updates. I didn't see a lot of stuff specific to like AAPC and any upcoming stuff. Like he touched on the CDEI and the free AAPC program, but usually they kind of tease some other stuff that they've kind of got in the wings, and I didn't see too much of that. But I was really happy to hear him talk about automation, because you guys know that I'm always trying to squelch those fears that people have about how, oh yeah, you know, artificial intelligence is going to take over all of the medical coding roles and this job isn't going to exist in a few years. And there was a lot of data that he talked about how 8% of claims use automation. In 2024, 88% of claims are still going to need coders, and the volume is increasing like rapidly. We're seeing a huge amount of claims, and not only that, but the complexity of the claims is increasing because of all the different regulations, all the different place of services, all the different code changes, all the different quality measures, federal regulations. So because of that, there's a lot more complexity. And while we can automate some of the more simple tasks, those more complex things are still going to need intervention. So even though we are seeing that there's going to be some computer assisted coding, we're going to need that because of the huge volume increase we're seeing in claims, plus the added complexity that's going to be happening in the healthcare industry. And it's going to make the coding jobs a lot better because we can focus on more in-depth, concentrated things, more complex things, versus doing these kind of like minor tasks that don't require a lot of thought process repeatedly. And when you even think about it, you know, what is going to pay us more? Things that are more specialized, that require more knowledge base, that are going to require more complexity, more thought process, or those things that we could essentially automate. So honestly, I predict that there is going to be an increase in the need of medical coders, but in a more complex way. Not saying that we're not going to need entry-level coders. We always need entry-level coders. But I think we're going to need some more additional complexity from the get-go, understanding some of those federal regulations, the insurance guidelines, understanding some more of the clinical picture, the business aspects, versus just knowing, oh, I know ICD and I know CPT. And then Ray did her presentation on E&M, and I always love to hear what Ray has to say about E&M because of her being on a lot of the discussions with the CPT advisory board. So she talked about the upcoming CMS proposed rule, how there are some changes that are going to happen for residents. So I'm definitely going to have to look that up. I want to make sure I know and I'm prepared for what's coming up with some of these resident changes. She also talked about some of the changes that are coming in 2023. So in 2023, they're going to be deleting the hospital observation codes, and they're going to be revising the hospital-based E&M codes. So that is definitely interesting. I never thought I would have seen the day where observation was deleted, but in a way it kind of makes sense, because we are seeing some patients now that are having a little bit longer observation stays, or are under observation for some things that are more clinically complex because of how well we're treating things on an outpatient basis. Now, I missed part of Rita's presentation because I had to run down to make lunch because I was in the virtual chat during lunch break. But she talks a lot about the personalized patient experience, and it's always so interesting to remind yourself of the patient experience. You know, as coders, we tend to get a little bit detached. We're just dealing with the back end stuff. We're dealing with the charts, we're dealing with the physicians, and we forget sometimes that there are really people out there that are essentially the customers of healthcare, and that there's a whole process involved in how they are flowing through healthcare. Now, Rita's worked for cancer centers for as long as I've known Rita, and you know, it was very interesting to hear her talk about how she has very different specialties and very complex regulations and processes as far as what they have to do with the insurances, even as far as things like pre-authorizations for these cancer patients, and that you can't expect just every coder to be all knowing of everything in every specialty, or all biller to know everything of every specialty, every insurance guideline, and that she has set processes in place in her organizations to really niche down the coders and be like, you know, you're going to do this specific type of service and the authorizations and services related to them, because we can't just expect someone to know, you know, everything in and out about Highmark or everything in and out about a Geisinger plan. That we have to have people who are specialized in specific areas. It is becoming increasingly difficult, even from our business perspectives, our billers, our coders, our revenue cycle people, to understand the complexities of everything that goes on in medicine, plus all of the different state guidelines, federal guidelines, insurance guidelines. It's a lot. So the jack of all trades, there's very, very, very few of them out there. She also talked about the quality metrics and how important those have been in tracking those to hone in on some of those patient experiences. Look at those press gainies, have those conversations with the patients about what it was in the experiences that they may have scored that healthcare organization lower on their press gainies. The infusion presentation, I took a ton of notes because I have never coded pushes, infusions. I've done injections, and that's about it. So I got at least my 3 key takeaways. That's my important thing. Every presentation, I want to get at least 3 key takeaways. So time is extremely important with infusions. There's a hierarchy involved, so I screenshotted that. I'm going to be definitely saving those slides. With hydration, if you actually have no time, you can't bill it. I took a lot of different notes in my code books. It was kind of hard to flip through as I was going through, but it made me kind of realize that if I'm doing presentations, you know, are people going to be trying to take notes on some of the things that I'm writing in their CPT book, and how I can make sure that in those cases, if they're newbies, like make sure I'm saying, okay, it's going to be this code, and how can I kind of correlate that now into these are maybe the notes you kind of want to take. So I'm going to go and make myself a cup of coffee, and then 7 a.m. is going to be virtual chat. My kid is up and ready to get ready for school at 8, so I'm going to have to tackle getting her ready. Next on my schedule for today, so there's the E&M panel from 8 to 9:15, and then, telemedicine. Virtual chat went well, lots of good conversation going on. If you're attending any of these virtual sessions, don't miss out on the chat, because that is the way that you can network very well with a lot of the other people in the conference and kind of see them face to face. The E&M panel is going on now, and I love the E&M panel because that's your time to really ask some of those questions that you might have and see if some other people in the industry are having the same kind of struggles that you are. E&M panel is going really well. There's some really good questions that they're clarifying about time, about shared services, about things like what is a level 5. So I always love to participate in the panels for E&M because they go over those questions that a lot of us are having and give some additional clarification, and then reference back to, oh, this is per CMS, oh, this is per the AMA, etc. I'm fixing my makeup in between sessions. I just got off the phone too. I was on hold for a while because I'm changing some of my plans for Disney for an upcoming vacation. That telemedicine panel was amazing. It was truly, truly great. Really, really insightful. I took a ton of notes. I should probably put my headphones back on so I can log into my next session. I think it's starting now. I don't remember what I signed up for. Ooh, general surgery is the next thing that I am signed up for. Here we go. This is a lively presentation, and I love when the speakers have a lot of emotion and inflection to them, not just slide reading or being very dry. I like to wear my headphones when I'm listening to presentations online because sometimes when there's audio issues, I feel like having it right in my ears makes it better versus trying to listen to on a speaker. I think the audio crackles and things are more prominent on the speakers versus on my headphones. It is lunch break time for day 2 of Regional Healthcon, so that telemedicine presentation was great. I wish I could send that telemedicine presentation to all of the people that say that medical coding is going to be eliminated by automation, because it was just very telling of the intricacies and the complexities that are going on, especially right now with the public health emergency, and how crucial it is to keep track of all of these changes, how the payers are viewing things, how we're going to change our internal policies, things like, different scenarios. If you're in a visit that's supposed to be an audio and video visit and then something happens with a technical glitch and it goes to audio only, like how do you handle that scenario? There was also some discussions about how to bill for the facility fees for telemedicine services, which I thought was interesting because I wouldn't even have thought, and I don't usually do a lot of facility billing, but I wouldn't even have thought about billing for the use of the telemedicine equipment and that constituting that facility fee for that. Along that same track of how do we keep track of the changes, and we use that doing spreadsheet tracking, there was a really interesting conversation that went on in regards to payers and how sometimes we have these representatives of the payers who we reach out to for guidance, and that there's actually some coders out there that are experiencing cases where the provider rep tells them, yes, you can bill this way, and that's actually not held water when it was viewed under the scrutiny of an audit, and that if a payer rep is telling you something, there should always be a policy to back that up. The general surgery panel had some really good engaging speakers. One of them shared her Facebook page, so that might be another resource you want to check out, Kim the Coder. I always love to support my fellow content creators, so you can check her out there. And I think a lot of it reiterated some of the things I talk about when I speak about general surgery, about knowing the medically unlikely edits, how to handle those, how to navigate the NCCI edits, how to review in the policy manual. There was a lot of good content about modifiers, and also in regards to the discussions on like laparoscopic to open procedures, how when you go in to perform a procedure and it's laparoscopic and then it converts to an open, we not only have to remember to only bill the open, but to throw on the ICD-10-CM code for the lap to open conversion as well. It was an excellent presentation, and the other thing I thought was interesting is I am someone who's very creatively minded, and I think it's cool sometimes to see how even a presenter who doesn't have decorated slides, like they were just plain slides with text, no fancy graphics on most of them, no little intricate, flower details and borders or flashing things or things popping up. And you still had a very engaging presentation because the speakers presented it that way. So you don't always need all the latest and greatest equipment, all the pop-ups, all the cash register noises that we used to see in PowerPoint, but you can still have a very informative, engaging, great presentation without all of those bells and whistles. While we were on lunch break, I quick ran out to my P.O. box. Guys, I've got some mail here. I think one of them might be pens. I'm kind of hoping. If you don't know that I have a P.O. box, it's P.O. Box 641, Fleetwood, PA 19522. It's actually linked in the description. It's a card from my accountant congratulating the birthday of my business. I didn't even realize that, but yeah, my LLC was started October 21st of 2020, so it's been a year now since I've been officially an LLC. Oh my gosh, my eye has been twitching all day and now I'm all emotional, and this is making it go even worse. Look at that, it's even signed from the team. I gotta bring her on the channel one day because she is so knowledgeable and so wonderful. Actually, she has a YouTube channel too, so if you ever want to check it out, Jennifer Reynolds EA, you can check out her YouTube channel. I will link that below as well. This one I think is from one of the chapters that I spoke at recently, so probably a little thank you card. Oh, look at how cute that is. Victoria, on behalf of the members and officers, thanks for your presentation. Oh, I actually have started really cutting back on my speaking presentations, which I feel terrible about, and I'm trying to get over the guilt, but I just have so much that I need to do with my business that I'm not going to be able to meet the goals that I've set for myself in my career and in my personal life if I'm continually just taking speaking engagements. I don't know who knew. Someone, I know it has to have been one of my viewers that mentioned about how I wore my Totoro t-shirt in one of my videos. Look at this. It's a little pen and notebook with Totoro on it from Hayao Miyazaki. Thank you. Oh my God, Hillary sent me pens. It says, I hope you enjoy these pens. Thank you for making such amazing content, from Hillary. Look at that. It's got little floaty pom-pom flowers in it. That is so cute. It's even the right color. It's the rose gold that I love. I'm so glad I made that trip to my post office to collect all of this, because this was the pick-me-up I needed. It's just been so stressful. I'm trying to do my conference and I'm getting notifications from the school and from the counselors, and then I'm on the phone with customer service trying to take care of something, and another phone call comes through while I'm on hold, and it's the place that sold me my dishwasher, and they're like, hey, we can come and take care of the issues with your dishwasher tomorrow morning. And I'm like, well, you can't come tomorrow morning because that's when my cleaning service is coming to clean the kitchen, so you won't be able to get to the dishwasher. Maybe I'm not alone in this endeavor. Is like everyone else's life crazy when you're just trying to sit and watch like a conference during the day and you're getting like emails and messages and phone calls and repeated phone calls, and it's just, I feel like I am just like the conductor of the Hot Mess Express over here. But at least now I will be conducting with a Totoro pen. All right, what's next? What have I got on my schedule? One of the cool things that they did for this Healthcon that I really like is every session, every breakout session, there's an E&M option. So they're kind of almost going down the line, which was a really good structural organizational thing. So there's one topic that they're going to cover for each session on different concepts of E&M. So it's not just like, oh, one person presenting the changes and then another person presenting basically the changes again, but they've changed the title of the presentation. So now they're developing these tracks, like they did that with RiskCon recently, like the introductory and then the people who are working in risk adjustment track. And now they have like an E&M track through in Healthcon, where it's like if you are someone who wants to do a lot of E&M stuff, cover all your bases, you can basically just take nothing but E&M sessions through the entire way through Healthcon. I actually didn't make my next selection yet. So we have either what makes a successful medical practice manager. Not super interested in. I love plastic surgery. If I was ever going to be a practice manager, it would be for a plastic surgery practice, but I don't think I could ever work in the office setting again. I'm pretty much stuck at home. Gynecology in the office, that's a good topic. I haven't done gyne in a little while, so it would be good to refresh on that. Anesthesia, coding, billing, and documentation nuances. Ooh, that might be the one. Next is emergency audit risks in the ED, and then documentation deficiencies. I think I'm going to go for anesthesia because that's, again, kind of like the infusions. It's an area where I'm not super well versed in, so it might be good to refresh myself for that area. So this presentation on anesthesia is done by Kristen Taylor, and it says the session will differentiate anesthesia procedures, including modifiers, concurrency, and medical direction based on who is performing the service, provide knowledge of interaction between the anesthesiologist and CRNA throughout the anesthesia procedure, and clarify the different anesthesia modifiers and how to determine the correct one, and discuss chart relation to billing. I should write better descriptions of my proposed presentations when I submit them for speaking engagements for conferences, because maybe that's why my last couple ones have gotten rejected. Or maybe it is because I am the conductor of the Hot Mess Express. I thought I just recorded this whole introduction, but it didn't take. But in any case, I have got for lunch cucumbers, tomato, cheese, and a little bit of red pepper, tuna fish, and ranch dressing. I'm not quite hungry for it yet though, but I will probably be soon. I moved my treadmill up to the underneath my desk, and my desk to the standing position, so I can actually get a little bit of a walk while I'm watching my presentations. That was a pretty good session. Now I'm checking out some of the exhibitors because I didn't get to check out the virtual exhibitor sessions yet. So it looks like there's not too many virtually. There's APC Codify, HC Pro Decision Health, and then Ohana Coding. The virtual conferences always have challenges. I'm not big into the challenges, but some people get really, really into them. So there's different ways that you can earn points. Things like if you're watching app tutorials, if you have the most connections, there's fun trivia. So it's another interesting way to just kind of keep things interactive. Natasha Timberlake's currently at the top of the leaderboard. Not shocking. Next, I am signed up for Sarah Reagan's session, Health Conditions of the American Trucker. Sarah's one of the viewers of this channel. I'm so excited for her speaking at her first conference. You can do anything in medical coding when you put your mind to it. Sarah's presentation was really, really great. Everyone was saying in chat how much they enjoyed it. They kept it very lively. There was a lot of discussion happening. Right after that presentation, I started getting just like terrible carb cravings, and I went downstairs and ate like a handful of potato chips and just crashed and took a nap. So I didn't get to record right afterwards my finalized thoughts for day 2. Although it looks like there was a pretty cool roaring 20s type dance that went through for the in-person, we didn't have too much going on for the virtual setting. For the in-person events, there's usually some sort of fun gathering like a VIP luncheon or a dance. A couple of years they tried to do this run, but the run I don't think turned out as well as they were hoping to. I think a lot of the conference attendees were not coming to conference and having to walk a lot and then run in the morning on top of it. I actually read in Healthcare Business Monthly a while ago that Mike Misko, who is currently the president of the National Advisory Board, he rolls off at the end of this year, but he's on the legal advisory team as well. He's very active in the AAPC. But they did this profile of him when he came onto the board as president, and it mentioned that in his youth, he used to be a DJ at parties, and I never understood why we've never had a dance party that he DJ'd, and we called it the Misko Disco. I missed the networking breakfast session this morning, but I did catch the presentation on ICD-10. So they had a panel on the ICD-10 CM updates. Some takeaways I had: history of HIV. There was some guideline changes to that. Basically stating that even though now we're making medical advances and HIV can be just about 100% cured, it's like more manageable these days sometimes for patients than diabetes. There is no code assignment for a history of HIV. So even if a provider documents a history of HIV from the coding standpoint, once they're diagnosed with HIV, they pretty much always have HIV. There's also some changes to depression. So it used to default to major depression, single episode, and now they've added in a code that is just unspecified depression. So it no longer will default to that major depressive single episode code. And one thing that I thought was really interesting that was brought up where we were talking about social determinants of health, which if you follow the channel, you know I stress a lot about social determinants of health and how important it is for keeping track of population health and different quality metrics, addressing things like patient literacy levels, their stress levels, if they're in foster care. And Colleen did mention that she is starting to see the social determinants of health codes, things like homelessness, being added to the state level risk adjustment coding programs. Then I did the presentation on critical care. Now, critical care can get dicey. There's still a lot of confusion about the fact that just because a patient is in ICU doesn't always necessarily mean that they are going to be able to be billed as having critical care services. And from the sounds of the discussion, there's a lot of differentiations between payers and states as far as can we bill split shared? Can we bill if 2 physicians that are employed by the same healthcare organization but in different specialties round on the same day. One of the things this speaker did that I really, really liked is she would show an example and then she would ask some of the questions for whether or not this would meet critical care criteria. You know, is time documented? Did we do this? Did we do this? And then she wrapped it up with so what is our next action after we found this out? Like, what do we do? Do we make education with the provider? Do we not charge this service? So I thought that was a very great way to walk through examples to really hone in on them. Me personally, being in an education role, it's really fascinating to me sometimes just to see the concepts that people use as instructors and how that can help people better interpret the material. I really wanted to attend the locum tenens presentation because I've had issues with locums in the past that were just like the speaker described, where there were these staffing agencies that said, yeah, we can staff you with locums, but they weren't really locums because in order to be a locum tenens, they have to be filling the shoes of a provider who's out for a 60-day or less period of time for locum tenens billing. These were really providers that they were hiring to augment the staff, to add additional people. I've seen some great little reference sheets made up for locum tenens billing. I'll definitely have to do a video on it at one point because it is an interesting concept, but one that is very easily misunderstood. She also mentioned that under the current public health She also mentioned that previously, before the public health emergency, locum tenens were limited to 60 days, and they have made some exceptions to that now because of the PHE. She also talked about locum tenens in the setting of a deceased physician, and I did run into that circumstance once where a provider who was actively seeing patients did pass away, and because of some protocols that were put in place, bills were going out in the organization under his name. But with locum tenens, the requirement is that the locums, in order to bill under the locum tenens regulations, is that they have to be filling the shoes of a physician that someone is seeking to see, and patients aren't actively trying to see a provider that has passed. She also talked about some of the perks of why providers want to work in locum tenens, because they like the flexibility. They can try out different specialties, different types of organizations. So I think that's a great thing. And that would be something that I would be interested in. I like kind of getting a little bit of flavor of everything. I actually thought that when I worked as a supervisor of medical coding that I had done just about every specialty. But when I really look at some of the things that other people are doing, particularly with outpatient facility and inpatient coding, I realized like how much of a narrow scope I really had, even though I touched a lot of different specialties. Before I give you guys my final wrap up, I just have to tell you this. So remember how I mentioned I was having all this trouble with coordinating things that were going on and that I was having a cleaning service come today? Let me tell you, when I pictured who was going to be coming to perform the cleaning services for me, I was not picturing 19-year-old Chad coming in smelling like a gallon of Axe body spray. So while I was in my presentations, he was cleaning my bathroom and then my kitchen dining room downstairs. He missed a few spots, so now he has to come back tomorrow. Because you know those little things like there's a little lip on top of the light switch, like it still is covered in dust. The kitchen sink didn't get scrubbed down. There's still like some grime in there. The backsplash from behind the trash can is still there, like the little splatter marks. So if I'd have attended this conference in person, that was one of the things I wouldn't have had to worry about. That's one of the downfalls of attending virtually, is not only do you miss out on some of that face-to-face networking, but you still have all of those household distractions that are going on. You know, I had to wake up this morning, make my kid breakfast, put the dog away, let the housekeeper in. So the last time I was attending conference in person, all I was worrying about was buttering up my Mickey waffles. You don't even have to in person actually worry about what you're having for lunch. Oftentimes the lunches are included. That being said, the AAPC did a really, really good job with keeping everything coordinated as far as being able to see the slides and the speaker at the same time. There were some times where people would ask a question and they didn't have a microphone, but I think a lot of the speakers kind of picked up on that and were good at reiterating the question, so there wasn't a lot lost in translation from the virtual setting from the in-person setting. And they did actively take questions from the virtual audience to the speakers that were there in person, which I thought was extraordinary. There's nothing that bothers me more than when someone's doing a presentation live or having a live stream and they don't engage with that audience, because the audience engagement is a big portion of doing that presentation. What you do in person with engaging that audience, you need to figure that out for online as well. I always remark to my friends of the difference between a professional conference versus the other types of conferences I've attended. So I've attended like anime and comic book conventions since I was a teenager. My sister actually used to run a video game convention towards Philadelphia. She sold it a few years ago, and I'm actually going this weekend because I've kept in touch with the people who still run it. Plus, my kid wants to be a professional cosplayer when she grows up, so she wants to go and dress up as characters for the video game convention. So I'm definitely used to a different atmosphere in conventions versus what you see in something that is a professional healthcare-oriented ordeal. When I attended my first professional conference, it was very unusual to me that like people weren't running around in costumes and stuff. It can be pretty intimidating, especially if you're someone who's there alone to network with all of these people. When I had my first Healthcon in Vegas, stayed in my hotel room and stayed to myself in the bars pretty much the whole time because I just wasn't feeling networking with other people. One of my big goals when I can finally get back to in-person, which should be Washington, D.C. Healthcon this year, I'm really looking forward to not networking with the bigwigs and my fellow board people. I want to meet everyone else, the people who are just starting. It's their first Healthcon, they're students, they're practice managers, they're not used to this stuff. Like, I want to meet all of those people and talk to them. And you guys too, so definitely come out to Healthcon in DC because I will see you guys there. All in all, this was so great. I'm glad I'm getting the recordings too, because there were some presentations that I was just like, ooh, gosh, I'm a little bit torn between this one and this one. And it's comforting knowing that you'll be able to circle back on those ones that you missed. So I think they're great options, whether you want to attend in person or virtual. You will still get that amazing, amazing content. And if you don't want to travel or don't want to get on a plane, you can always get that same amazing information and interaction virtually. Oh, and if you want to see me opening the swag bag that I got for Healthcon, you want to check out this video here. I will see you guys in the next video. And until then, just keep on coding on.